In the fast-moving world of news, it's easy to miss the meaning between the lines. That's where we come in. Each episode, we take real headlines from Newsline Philippines and let AI break them down. Not just the what, but the why it matters.
Welcome to another deep dive. We grab a source, break it down, and pull out the key takeaways for you.
That's the plan.
Today, we're looking at a specific health measure that's just been rolled out in the Philippines.
Right. Our source is a recent news reports from Newsline Philippines.
And we're zooming in on one particular province, Davao del Sur.
Exactly. An executive order just dropped there. And, well, our mission today is to unpack why. Why this specific action right now? And what does this news report actually tell us about the situation and the disease they're concerned about? Okay,
let's jump in. Based on this report, what's the big move in Davao del Sur? What are they actually doing?
So the main thing, the core of this executive order, it's number 20, series of 2025 from Governor Yvonne R. Cagas, is a mandate. Face masks. Yeah, they're now required in all public places across the whole province.
Wow, okay. Mandatory masks again. What's triggered this, according to the source? Is there an outbreak?
Well, that's the interesting part. The report is pretty clear on the reason. It says, quote, amid rising Mpox concerns.
Mpox, right? That used to be called monkeypox.
Correct. The source actually uses both names, kind of interchangeably. It mentions a re-emergence of cases, not just elsewhere in the Philippines, but globally too. So the provincial government there is taking what they're calling a firm stance on protection.
But hang on, I read something in the report. It said, while no confirmed Mpox cases have been reported in Davao del Sur as of this writing. Is that right?
Yes, that's absolutely key. No confirmed local cases yet.
So they're mandating masks province-wide without any cases there.
Exactly. And the source really frames this as a proactive step. It's part of heightened health protocols. The whole idea is prevention.
Okay.
They're trying to prevent a potential outbreak based on the situation elsewhere, not reacting to something already happening locally. It's like an anticipatory measure.
Right, getting ahead of a possible threat. So what does the report tell us about Mpox? How do they describe the disease itself?
It draws on info from the Department of Health, the DOH, and also the World Health Organization, the WHO. Key authorities.
Makes sense.
And it describes Mpox as a rare viral infection. Now, transmission. It says that happens mainly through direct contact.
Like skin to skin.
Yeah, direct contact with the skin lesions of someone infected. Or touching contaminated things, bedding, clothes, that sort of stuff. And also, interestingly, through prolonged face-to-face contact involving respiratory secretions.
Respiratory secretions. Okay, that connects directly back to the mask mandate then, doesn't it?
It certainly seems to be part of the rationale, yes.
What about symptoms? Does the report list those?
It does. Common ones like fever, headache, muscle aches, back pain, also swollen lymph nodes, chills, and fatigue. And it mentions a pretty notable symptom, a rash.
A rash.
Yeah, it typically starts on the face, then spreads, and eventually forms scabs.
And how long does this typically last? Are we talking days, weeks?
The source says the illness generally lasts for about 2 to 4 weeks. It does note most cases are mild.
But not always.
Right, there can be complications, especially, for more vulnerable people, young kids, people with weakened immune systems, pregnant women.
Got it. So just to recap the order itself, mandatory masks in all public spots, markets, schools, churches, terminals, government offices, public events, everywhere, basically.
Pretty much covers all public spaces, yeah.
And who's supposed to make sure people actually follow this?
The report points to local leaders and personnel. They're tasked with enforcing compliance. But it's not just masks.
Oh, what else?
The Provincial Health Office, according to the source, has also kicked off information campaigns.
Educating people.
Exactly. Educating residents about symptoms, how to prevent spread, and stressing, the importance of seeking medical help early if they think they might have it.
There was that quote in the report from the governor, Cagas, something like, community discipline and early prevention are our strongest shields.
Yeah, that really sums up the philosophy here, doesn't it? It highlights what the source emphasizes. Public cooperation, taking action before things get bad.
Preemptive action.
Right. And the report also mentions they're coordinating with the national DOH for potential support. Things like vaccination, maybe surveillance, testing. Shows they're preparing for different scenarios if things change.
And importantly, they're urging vigilance, but also calm, right?
Yes, that's a crucial point the source includes. Health officials quoted are advising residents to stay calm, noting that Mpox is considered far less transmissible than COVID-19.
Okay, so let's pull this together. We've seen Davao del Sur bringing in mandatory masks proactively, not because of local cases, but, according to this news report, because of rising Mpox concerns elsewhere.
A preventative strategy based on perceived risk.
We got the source's description of Mpox, how it spreads, the symptoms, how long it lasts, and we see multiple actions. Masks, info campaigns, coordinating with national health bodies.
It's a really clear snapshot of one specific locality deciding to act early, really banking on prevention and getting the community on board, as the report highlights.
So, thinking about this whole situation, the mandatory masks, despite no local cases, the emphasis on vigilance, but also calm, the comparison to COVID-19's transmissibility, it raises a question, doesn't it? What does this specific report suggest to you, our listener, about the tightrope authorities have to walk? Communicating risk effectively and keeping public trust when they bring in these big measures before an outbreak actually hits home. It's a really delicate balance that seems implied by this source, something to think about.